For anybody who's just joining us, Helen Friedman, Dr. Helen Friedman, is a clinical psychologist, and she has a private practice. She's currently using telehealth to meet with her patients, and she is also the president of the St. Louis Psychological Association, and lot of expertise you're going to be able to bring to this conversation about maintaining mental health. So thank you. Again, why don't you just tell us a little bit about yourself?
Great. Well, I've been in private practice since 1981 here in St. Louis and have a general practice as well as some specialties. And the general practice is dealing with anxiety, depression, stress, relationship issues. And then there's I have some specialties: post-traumatic stress disorder, dissociative disorders, gender identity, sexual compulsivity, and but understanding relationships, and it's really the foundation for all of those things.
Very interesting work that you do. So let's talk about what you're seeing right now in the sort of time we've been, the last month and a half, let's say, since most of us are thinking about COVID all the time, but what's going on with your patients?
So I don't know about just with my patients, but with everybody. We're all going through a grieving process. Life as we knew it has been so severely altered. Our routines are different. Mm-hmm. People have lost a sense of normal life. People have lost loved ones. People are living in fear. Most of the people I work with have been very prudent. But just talking in general, people are going through all kinds of things: loneliness, anxiety, fear. Will they get the virus? Some people, of course, are in denial. Elizabeth Kubler-Ross discussed the 5 aspects of grieving: and denial, anger, bargaining, depression, and acceptance. So we see some people gathering in large groups right next to each other, despite what the medical professionals are saying. But other people live in fear, knowing that people who are asymptomatic could infect us. So there's disruptions in sleep. People are homeschooling their children who never imagined that they would be doing that. So it could be exhausting. Also, with our need for technology, people have had to scramble. I'm one of them. The first week of doing total telehealth, my old iPhone, years ago I ported my office number to a cell phone, which makes me more accessible. My old iPhone was dying 3 times a day. Mm-hmm. Because I wasn't seeing people in person. I was using the Cash App. One day it worked, the next day it did not, because they updated the app and my old phone no longer supported it. Mm-hmm. So what do? You can't go to an Apple store these days. How do you transfer your data from your old phone to your new? You have to figure it out yourself. So necessity is the mother of invention. People are giving themselves haircuts, mm-hmm. Learning technology. It's been quite an adjustment for many.
Yeah, I would say, just on a personal note, we had to up our internet. My husband and I both work virtually, and our internet wasn't sufficient to necessarily support my son e-learning in the morning while we were holding a virtual meeting. I was holding one, my husband was holding another. So we've had to deal with that technological. It's very stressful. I find technology extremely stressful, trying new things. But at the same time, what you're saying about haircuts and those things, I've also noticed, we're spending so much more time with our children. I'm spending more time preparing meals. I feel like I've stepped back in time almost to a simpler time, in a way, where we don't have to run around like chickens with our heads cut off from one appointment to the next, one activity to the next. And that's been actually refreshing. And when I drive through the neighborhood, more people are out with their children taking walks, and there's, a strange sense, almost more of a community, even though we're a little bit more isolated. So I feel like there's a lot going on for people to adjust to.
There is, and I've noticed the same thing that you're saying. It's so nice to see neighbors and
Absolutely.
going for a walk. People wave and say hello from a distance. People are friendly. They're glad to see fellow human beings. And as we're hearing all the time, we are all in this together.
We are. We are. Well, let me ask you then, what do you have? Do you have recommendations for people who are not doing so well right now, maybe not coping with the isolation, maybe feeling angry? I mean, there is some of that anger with some people being forced to accommodate other uh, rules that they have not been exposed to before in their lifetime, perhaps, and people on the front lines in hospitals. Do you want to say anything about tools they can use?
Sure, people in front lines in hospitals really are having it rough. Now, some hospitals are emptier than usual because they didn't want to use personal protective equipment that might be needed later. But people on the front lines are fearful of getting the virus, of bringing home the virus, um, can feel really burned out. So everyone needs someone to talk to, and friends reaching out by phone, reaching out by video. Video has been just wonderful for so many people. Um, so some of it is staying connected, and there are many ways. One thing about us human beings, we human beings, is that we don't like uncertainty. There's research that people like to know it's this or it's that, to be able to make plans. And right now, with things changing from week to week, from day to day, there's so much uncertainty, and that has been stressful. And sometimes just normalizing that. I think most people have good days and bad days. Some days feel just fine, and other days it hits them.
Mhm.
So we all need each other and to reach out to one another.
Um, do you have any resources that people might be able to access to help them if they don't have somebody to talk to, a neighbor or a friend or a family member?
Uh, yes, and I think I sent you a list of psychologists who are open, and also there's an article that I believe you're going to post
Mhm.
um, for us all, and there are also I have a list like Mental Health America has a whole lot of support groups. These are free that people can access. Anxiety and Depression Association of America. Now, that's probably more for people with clinical anxiety and depression. Any one of us could have depressed mood, but that is different than a clinical depression.
Mhm.
Um, there is a behavioral health response, which can be accessed online. All these are free if somebody would like to just call and talk and just have a supportive ear.
Great.
And and reaching out to friends. Sometimes people find it hard to be vulnerable and to share. They're not doing well, but I think that's true for most of us. That there's days we feel just fine, and other days it's tough.
Yeah. So I will, by the way, I will be posting the list of psychologists that are making themselves available. I will also post with that the link to the article. Could you tell us a little bit about the article that people are going to go visit when I make that post on my Facebook page?
Absolutely. So I was interviewed in an article that's online on a website called Shondaland, and it's called How to Connect Socially During Social Isolation. Now, the truth is, it's really not, um, we don't want to be socially isolated. It's really during physical isolation. So, in the media, the popular term is social isolation, but we want to stay socially connected. And so, some of the ideas are pick up the phone. These days, we don't have long phone conversations like we used to, but pick
Mhm.
up the phone, hear somebody's voice. Um,
Right.
and also the video, I could tell you, I have already experienced a college reunion. There's a group of friends, and we haven't seen each other for years. and we did a Zoom mini reunion. On 23andMe, we found some second cousins we didn't know about, and our grandmothers were sisters, which is pretty amazing. So we had a first meeting, a virtual family reunion, which is pretty incredible. People form book clubs. I'm a member of a movie discussion group, and we've met on Zoom. So trying to keep up with normal activities. And another thing is humor. Humor is, we all need some lightness, and we want to be informed. Knowledge is power in order to protect ourselves. On the other hand, we also need to unplug from the news 24/7. It gets to be too upsetting if that's all you're doing. And so humor, sending funny videos or jokes can really help lighten things up.
Great. Okay, well, I think we're going to wrap it up if that's okay with you, Helen. If people have questions for Helen, since we're not actually able to do this live, for Facebook is not allowing that at this moment, we will post this video. And if you do have questions for Helen, please forward them to me at helenawebb.com. I'm going to put a slide up at the end here, which has the website, and it also has a view of the psychologist list that I will post online, so you see what that looks like in advance. Thank you so much, Helen, for being here. I think what I'm getting from this is, we're all going through a lot. It's normal to have a lot of new feelings, and that, reach out, keep communicating, take care of yourself, but stay optimistic, because we're all in this together, and this is normal. It's a different time than we're used to, but take care of yourselves, try to maintain a positive attitude, and we'll get through this together.
And one last thing I'd like to say.
Yes.
For those people who find themselves needing to go into Illinois or returning on 64, there's an amazing site on the riverfront. I think it's the Casino Queen, I'm not sure what it is, but is lit, has lights in the shape of a heart. There's another building with a huge heart. And so at times like this, people are really reaching out and feeling the love. And that's really important now.
I really think that's a great way to end this segment. Thank you so much for being here, Dr. Friedman. And we'll catch up after and post this video for everybody to see.
Thank you.
Thank you so much. Have a great day.